We're live.
Thank you. Good morning and welcome, board and online viewers, to the November 5th Board of Health meeting. The board meeting is officially called to order at 8 a.m. This virtual meeting is being streamed via YouTube with rebroadcasting later on Facebook. The October Board of Health minutes were distributed to the board for the review prior to the meeting. We will postpone our approval for the minutes after we meet quorum. For now, we will proceed to go into our perspective. I'll go into the chair business updates and actions items. Today, we remember and pray for the lives lost and for all those injured or affected by the catastrophic cargo plane accident that happened yesterday in our city. We also want to express our deepest gratitude to the immediate responders. I would like also to share that Louisville Metropolitan and Wellness Emergency Preparedness Team were at the Operations OP Center, working along with MSD to monitor the runoff to protect as much as possible the public health of our city. A reminder that due to the necessary shelter-in-place order, JCPS will be closed today, but fortunately, this shelter-in-place order has been reduced to a quarter of a mile surrounding the airport. November is the Native American Heritage Month. Also, it's the National Diabetes Month. This is very important because this aims to raise awareness about the diabetes and the impact of millions on millions of Americans. With this awareness, the intent is to promote healthy lifestyles and supporting research for cure, encouraging all the community members to take action. With the arrival of the cold weather, it is important to remind the community to get flu, RSV, and COVID immunizations. We are still getting rising rates of respiratory illnesses reports, and unfortunately, this affects, those that are most vulnerable, very young kids and elderly. So everybody, please remember, invite and remind the whole community to get the immunizations. It is important for all of us. According to the organizational and operating rules of the Louisville and Jefferson County Board of Health, the positions of chair and vice chairs have terms of 1 year. Dr. Eccles and I were elected in July 2024. After a conversation with our appointed lawyer for the Board of Health, Natalie Johnson, she is also Assistant Jefferson County Attorney, we will have all appointed or reappointed members of the board. And with this, if we meet quorum today, we will proceed with the chair and co-chair elections if we have quorum, as I mentioned. Now we will proceed.
Have a quorum.
Excuse me?
We currently have a quorum.
Oh, thank you so much, Arlena, for letting me know. Now that we have reached quorum and knowing that the October Board of Health minutes were already distributed and reviewed, are there any discussions or amendments to the minutes? And if not, do I have a motion to approve the minutes as distributed? I have a motion by Ms. Margulis and a second by Ms. Karen Rascal. Yeah. Any all in favor, please raise your hand, and remember your camera has to be on and your hand has to be high. Say aye.
Aye.
All in favor say aye. Can we count, Arlena, please?
I need Dr. Eccles still, please. Okay, yes, ma'am, we have.
Okay, thank you. Any oppositions? Any abstentions? So we have a quorum and the minutes are approved as distributed. Thank you very much. And with this, so now we have a quorum and we will proceed with the elections at the end of our meeting today. Let's proceed to our perspective session. Today is really interesting and very exciting The topic for today is the Park Alliance of Louisville and its impact on Louisville's public health. The presenter is Brooke Pardue, President and CEO of the Park Alliance of Louisville. And she, after serving on the board for 5 years, and the last 2 as chair of the board, Brooke was hired as the first employee in 2017. The transition to president and CEO continue her passion for public service, following 10 years also working for Congressional John Jarmuth. She believes strongly that a just and healthy community requires equitable access to quality green space for all residents. Today, I present to you Ms. Brooke Pardue. Welcome, Ms. Pardue, and if you have your presentation ready and you would like to share it, you may do so at this time. I yield the floor to you.
Thank you so much. So truly honored to be here with you today to talk about our public parks. We believe strongly that public parks are public health. I'm joined today by my colleague, Alice Bridges, who's going to be helping share the presentation. So the Parks Alliance of Louisville is a nonprofit supporting our Louisville Metro public parks. Here is our mission to drive equitable investment in our public parks to improve the health and well-being of our entire community. We like to say that we do 3 things. Number 1, we advocate with our elected officials for more funding for our public parks, and we'll get into why that's important in a little bit. We educate the community on the power of having quality public parks, and then we activate supporters to invest in priority projects. So like I said, we are a nonprofit. We are blessed by lots of donors to the work that we do. So Alice is going to share a quick video with you guys that just gives you some background on who we are and what we do. And then we can get into a little bit more about our work.
Every person in our community deserves access to an exceptional park in their neighborhood.
Parks Alliance understand that we, the community, live here.
We're listening to the residents, continuously soliciting their feedback.
It lets you know that you are important and what you say is important.
If we ensured that everybody had walkable access to an exceptional park, we would improve mental, physical, emotional health. We would improve the environment. We would reduce crime. We would increase educational attainment. All of those things are tied to investments in public parks.
With the backing of the sponsors and the team of Parks Alliance, we're going to open up some ears and eyes, and we're going to get stuff done.
So thanks, Alice. There are study after study out there. The statistics we're getting ready to share with you are specifically from the City Parks Alliance, but we are continuously learning about the impact on an exceptional green space to the community that it serves. I think we all understand planting more trees reduces urban heat island. People that actually have access to quality parks have lower rates of obesity, heart disease, and diabetes, as we were just talking about. The children in leafy neighborhoods are 3 times less likely to have asthma. When it comes to greening of vacant land, that has been found to reduce gun violence by 29%. These are simply important statistics that everyone needs to be aware of. Folks that live near parks and green space are 44% less likely to have a diagnosed anxiety disorder. Think about that for a minute. Just having access to nature is reduces anxiety and depression actually as well. They are, we talk about green stormwater management as opposed to gray stormwater management, greening of vacant land and planning our green spaces to absorb stormwater, reduces risks of flooding. And you know, one of the things that we talk about here in Louisville is that we develop plans and folks have to take their plans to MSD, and basically MSD has to say this project will do no harm, as opposed to starting with MSD and saying, we have this vacant land, we need to develop what is the infrastructure that we need to create in this land, and then putting in the amenities that folks need. And as we encounter more and more impacts of climate change, this becomes increasingly important. One of the major projects of the Parks Alliance of Louisville is Alberta O. Jones Park in the California neighborhood. That park actually came out of a massive flooding event in 2009, where the homes in the area were flooded by the impact of a major rain event that overran the sewers in the area. So although California is nowhere near the Ohio River, folks had to be rescued by boat because of the impact on the sewer system from that rain event. We have transformed and are still in the process of transforming almost 20 acres of land in that area. And we're using this as kind of a microcosm for the Parks Alliance to really do a deep dive in how to do community outreach, how to ensure that the amenities that we provide are reflective of the needs of the community, as well as doing extensive programming in the area, and then studying the impacts on what that has done to the community. We use a tool called Placer AI. So we're actually able to look at anonymized aggregated cell phone data for folks that have come to the park, and we have logged more than 75,000 visits in the last 2 years in an area that has been blighted for almost 2 decades. Alice, I'm going to ask, because she's really been our expert on the health impact assessment that we are doing around Alberta Jones. I'd like Alice to share a little bit about that, and then we will get into the studies that we have done around our park system in general.
Thanks, Brooke. Yes, my background is in healthcare. I've had the opportunity to work with some of the people on the Board of Health, including Dr. Goldberg, when I was at Jewish Hospital. And the reason I became involved in this work at the Parks Alliance was my interest in creating conditions in the community that really encourage human thriving. And I am all in, all my chips on parks as a catalyst for building health and well-being. We've had the great opportunity to partner with the health department and the formerly Center for Health Equity, I think now the Center for Population Health, on conducting a health impact assessment around Alberta O. Jones Park. So we've got a fabulous foundation of community. We call it a people-powered park, where we really, from the beginning, built it with direction, stewardship, and ongoing guidance of residents about what they want this green space to be to help their community be vibrant, healthy, and connected. So with our partners, with the health department, we're close to completing a health impact assessment, which I believe is the first time the department has used a place as the opportunity to conduct that prescribed process of evaluating the health impacts, both negative and positive. But normally they've done it on a policy, and this time it's around a place. So by the end of the year, we hope to have a report that it shows how this space and how residents want to leverage it to advance health and well-being. And we're really hoping it informs future city policy around the development of green spaces. And it's very interesting what we've already discovered from the community, their definition of what makes it a place that can drive good health are not just the environmental benefits, which are the obvious, but two surprises for me were how it creates a sense of belonging and how it can either create a sense of safety or cause people a concern about their safety. So those elements are going to really be central. The environmental, the safety, and the sense of belonging are sort of the foundations of the recommendations and results coming out of the HIA. So we're very excited about it. We're working with Kathy and her team that will create the report, which I think will include a web-based piece that makes it very accessible to anybody and in very understandable terms. So we can really share this great work with the whole community.
So I really recommend that you all check out this Hidden Brain podcast. If you all are familiar with Shankar Vedantam, he did a podcast or one of his episodes with a researcher from the University of Chicago, and it really brought into clear focus how important access to green space is for us as human beings. And I'll just share one of the things they talked about was that we spend hundreds of millions of dollars a year on ensuring that animals in zoos have access to their natural habitat, because we understand if you take a lion out of the savannah and you put it in a cage and you give it food and water, it is still going to die because it needs to be in its natural environment. And for us as Homo sapiens, our natural environment is nature. And to take folks and put them in a concrete jungle with no trees, urban heat island, and then expect them to not only survive, but to thrive in that environment is just literally not in our DNA. And so to really take that approach to health, as though we were animals in a zoo and creating our natural environment every place that we possibly can. Really powerful, and I strongly recommend you all give that a listen. So while Louisville is very proud of its park system, and justifiably so, we do have an amazing Olmsted designed, system at the core of our public parks. We are really falling behind. In 2022, we did a study that we called Parks for All that looked at how our public parks in Louisville stand up to nationally, and then a deep dive into the condition of our parks. I will say in 2020, Louisville ranked 80th out of the 100 most populous cities in our park store, according to the Trust for Public Land. And in 2025, we are now 96th out of the 100 most populous cities. That is not necessarily because we're doing worse. Actually, in the last few years, we have made more investment in our parks than we have in a very long time, but it's because other cities have really doubled down with the understanding of how important our public parks are to public health, to the economy, to as a talent attractor, and to the environment. So what we found in our final report from Parks for All is that Louisville is spending, the public spending on our public parks is $40 versus $107. Our philanthropic spending is only $3 versus $11, which gives us a total of only $43 versus $118 in spending in our public parks. Everybody can talk about, what are our benchmark cities, what are our peer cities. We just looked at it based on population. And so to the right there, you can see the cities that we compared one another to. We then looked at the condition of the neighborhoods that those parks serve. So by census tract, we looked at population density, historic inequities, environmental justice, and health and wellness. And you'll see that in health and wellness, we included crime, physical health, and mental health, because we wanted to get not only the condition of each individual park, which we did, but the condition of the neighborhoods that those parks serve. Not surprisingly, here's the map. Very similar to lots of maps that we see about health and environmental issues. It's the same kind of map. But because we are facing this deep hole in deferred maintenance, we also wanted to look at how do we prioritize those investments. And we felt that we needed to prioritize parks that were in neighborhoods that stand to benefit the most from a quality park in their neighborhood, right? And so we then went and did an assessment of every single park. We have 124 public parks in Louisville, which folks find surprising. Because typically when I ask people, what are your favorite parks? They can maybe name 5 or 6. We have 124. And then we ranked them based on the same community needs score. So Alice, if you could move to the next slide. Oh, here we go. What we found is that 81% of our parks are in worse than good condition. And this was an assessment that was guided by the national team that we brought in to do this work, but actually conducted by the Parks Department employees themselves. So they gave them the parameters. More than 25% of those 124 parks have not received any funding since merger. So we're looking at more than 20 years. And the vast majority of those parks are in neighborhoods that stand to benefit the most from access to an exceptional park. So this is the top 3 priority sites. I also welcome people to look at the names of these parks and see how many of them do you recognize. A lot of folks are not familiar with these parks. But once again, they're in communities that stand the benefit the most from having an exceptional park. We are already working on this list, though. You can see the parks that are supported by the Olmsted Parks Conservancy. You can see the parks that the Parks Alliance has been working on. Ballard right now is being completely reimagined and is under construction and will open in the spring. We have already completed the community outreach for G.G. Moore Park and are currently fundraising for that project. And then Memorial Park is next on our list to tackle, and we're actually working with U of L on a really amazing project with the Rhode Island Institute of Design and the University of New Hampshire on how it is that we go about doing community engagement around these parks. But we broke all 124 parks into 10 buckets. So we're just looking at the top 3.
Ms. Pardue, you have 1 minute to wrap up.
Okay. We also did a citywide poll on how folks spend their time in parks, how they want to prioritize spending in our parks. But this is truly something that impacts virtually everyone in the community. And honestly, folks are not looking for super fancy things. They basically want us to fix what we have, to open the bathrooms, to pick up the trash, to cut the grass, and to make sure that the amenities are safe. And this is our 15-year plan to get us where we need to be in competition with our peer cities.
Are there any comments or questions for Ms. Pardue?
This is
Yes.
Delmore Manson from the Kentucky Nurses Association. This is an incredible presentation. I had no idea, and I have lived here some of my life. So thank you for opening our eyes.
I have a
Go
couple
ahead,
of questions.
Mhm.
Yes, if I might. The core of my question is really about partnerships and partnerships in a couple of different directions. So as you were presenting, I was thinking to myself, well, I think there are more green spaces in the Jefferson County than what you list on. So like some of the smaller cities have parks. I live in St. Matthews, so I didn't see any of the St. Matthews parks there. So my question is, how does your group partner with other green spaces that serve the metropolitan area? And then you should never ask 2 questions in one, but I know we have a limited amount of time. The second partnership question is, how do we partner with Louisville Metro and addressing security issues and really thriving on striving to make our parks absolutely as safe as possible? Can you comment on those kinds of partnerships?
Absolutely. I would say number 1, the mission of the Parks Alliance of Louisville is specific to our Louisville Metro parks. And so our work has been targeted to those areas. We are always happy to partner with other organizations. We actually partnered with 61 different nonprofits in the last year. But our mission is to support our Louisville Metro public parks. And to the second one, safety is a huge concern for people. And we certainly know from all of the community engagement that we've done is that safety does not fit in a neat little box. Everybody's definition of safety is different. We do have a park ranger program now that Louisville Metro has implemented. And I will say Chief James is an absolute jewel. And we appreciate the work that he does. But we also know that when it comes to investment in parks, it's not like you can have just sort of maintaining the status quo if the park has not been invested in. You have a negative impact when it comes to safety if the park has not been invested, because it ends up being a magnet for bad actors. And, you know, what we've been able to see at Alberta Jones is once you not only invest in quality green space, but you then program it, that you bring the community in, that you provide the things that the community wants to see, that in and of itself, creating that community, neighbors knowing one another, that reduces crime. And so it takes a very delicate balance and a lot of different I mean, just simply putting in lighting is huge. Folks ask for lighting all the time. Once again, bad things happen in a vacuum, in a space that is not occupied, and then a space where folks can hide. And so there is a multi-pronged approach to creating a safe environment for folks.
Thank you.
Just echoing, the good job that the Alliance Parks is doing. And, I'm going to back up Dr. Hedges' suggestion, just adopting a park or adopting lighting, creating those partnerships, not only for the immediate community surrounding those parks, but also involving the whole community. We have a lot of companies that would love to have, this is the partner park, this company is taking care of the sustainability. That's what we need for those parks, not only lighting, but cleaning. And so keep on doing what you're doing. And thank you from all of us and for the whole community, and involving the community in the decision and the starting on the projects is key. Otherwise, there's no taking care of or keeping up or following. Anybody else?
It's
And
Dr.
with that,
Goldberg.
oh yeah,
Yeah.
go ahead, Dr. Goldberg.
Thank you very much for the presentation. It was very informative. Alice, great to see you again. Any updates on work involving closing the Louisville Loop? I'm asking because it not only literally but figuratively helps connect our various neighborhoods around the city. I was asked yesterday about the construction along River Road and whether any of that was going to involve bringing that section into the Louisville Loop, and I didn't know the answer.
I would say that Deputy Mayor George is here, and she could speak to that much better than I.
Thank you very much. We will wait for for Deputy Mayor. Deputy Mayor, do you have a comment for this?
Good morning. And first of all, I just want to thank Brooke and Parks Alliance for the presentation this morning and all the work in terms of looking at health and the impact of greening and connection in our community. In terms of the Louisville Loop, the answer is yes. Mayor Greenberg has recently asked that both Parks and Public Works bring additional focus to the Louisville Loop. We have several loop projects underway. In fact, there's a new website that I will link in the chat to be able to follow these projects. We're also looking at enhanced maintenance. One of the ongoing challenges with the loop has been maintenance. And as you heard Brooke say, people just want great places to walk that are safe and clean and have access to water and just the basics sometimes. So there's, in terms of priorities, maintenance and completing what we have committed to are the top two focuses. So I will put that in the chat.
And thank you so much. And with this, we want to thank you, to thank our presenters for the sharing of this project that brings a lot of good, positive, factors on the public health work that the whole city is doing. Thank you so much.
Thank you.
And with this, I will say we will continue our agenda and allow time and space for updates and reports for the mayor's office. And now I yield again the floor to you, Deputy Mayor Nicole George.
Thank you. First of all, in light of yesterday's tragedy, I would say all hands are on deck here in the way of response. I want to give a big thank you to all of our first responders, and of course that includes public health. I see several of my colleagues are on here, and I'll defer to them, but I know they've done tremendous work since yesterday. They have a lot of work ahead of them, and we're here to support. Thank you.
Thank you, Deputy Mayor George, for that update. And for the director's update, now I yield the floor to Louisville Metro Public Health and Wellness Executive Director, Dr. Inder Singhal, who will share us the highlights for the director's report and what's going on right now with the
Yep. Good morning,
team.
everyone. First of all, great presentation, Brooke. Great work being done at our parks and alliances. On the Metro Health side, you all have a director's report. The few things to highlight. Number one, there could be some confusion between WIC and SNAP benefits. So WIC is still fully funded and fully active. Our families who require WIC help, they can reach out to our Metro Health, and we're actively enrolling. And there are a bunch of my team members on this call. We're working actively to support those people. SNAP benefit, I keep on hearing I don't have good knowledge of what's happening, but we keep on hearing half is funded, half is not funded. So I don't have enough knowledge on that. Couple of things, interesting tidbits. There were two bats in 40059 and 40207 who tested positive for rabies. Fall is their mating season, then they go into hibernation. I'm learning so much about bats, honestly. So try to avoid if you see bats, and please make sure that if you encounter bats in your home, stay away and inform pest control so that they can be taken care of. My biggest push will be this morning, as always, is the vaccination, especially now we are in fall season. Let's encourage everyone to get flu vaccine. We are hearing that this year flu could be far worse than even the worst season in 2010-11. Flu is not just few days of inconvenience. It could be deadly for our vulnerable population. So let's do our part. Let's get immunized, and flu vaccine is available everywhere. In the same vein, especially our pregnant women, let's make sure they get COVID vaccine, and then RSV is available as well. I think wherever we are, we're all part of Board of Health, and this is important that we continue to have these conversations wherever we are and encourage people. Any questions for me or any comments?
Anybody? Thank you. Thank you so much, Dr. Singhal. Appreciate it.
Thank you.
Now we go to family health centers, and I yield the floor to Dr. Bart Irwin.
Thank you. Well, there are many things to be concerned about. One thing we're in particular concerned about is the expiration of the premium tax credits out of the Affordable Care Act. And for more information on that, I'll defer to our resident expert, Ashley Shoemaker.
Yes, so our Outreach and Coverage Coalition met on October 13th, and our focus was on the marketplace open enrollment and the expiration of the enhanced tax subsidies, I want to begin by mentioning some important open enrollment dates because there are several different open enrollments taking place right now. Medicare open enrollment is October 15th through December 7th. The Marketplace open enrollment is November 1st through January 15th, but enrollees must choose a plan by December 15th to ensure January coverage. For Medicaid, there is no open enrollment. Qualified individuals can enroll at any time or change their MCO at any time during the year. Because Congress has not extended the enhanced tax subsidies that are set to expire at the end of this year, Marketplace premiums are increasing across the board. Kentuckians are seeing premiums increase on average $100 a month. Just anecdotally, I've worked with people that run sort of the gamut from as little as an $8 a month increase to over $180. This is just within the first couple of days of open enrollment. So some people could see their premiums increase much more than $100. In Jefferson County, there are over 18,000 residents who currently have Marketplace plans. So this affects all of them. The premiums are going up across the board. Additionally, there are fewer options available for plan year 2026. CareSource has left the Kentucky market entirely. And Passport by Molina, their Marketplace plans, they are leaving Jefferson County and the surrounding counties. I do want to be clear that Passport will continue to provide Medicaid, and they will still be a Medicaid MCO across the state of Kentucky, including Jefferson County, but they are withdrawing from those Marketplace plans. Except for a handful of counties in central Kentucky. I'm going to include a couple of links in the chat. The first is a map of the insurance plans that are available across the state. So in Jefferson County, the two options are Anthem and Better by Wellcare. Between those two insurance companies, there are, I believe, 42 different plans available, which is, I think 10 plans less than the previous year. And then I'm also including a link where people can find local help. Because of all of these changes, it is more important than ever that members take action to look at the plans and actively shop for a new plan. And connectors are a free resource that's available in the community to assist people. We also want to encourage anyone that's affected by these premium increases to contact their elected officials. It is not too late for Congress to take action to extend these enhanced tax subsidies. The Department of Insurance had plan issuers file two different rate filings, one with the enhanced tax subsidies and one without. So if those subsidies are extended, I've been told that it would be a fairly simple change to go in there and update the system to reflect claim prices. And so we do want to encourage everyone, if this is something that impacts you directly, to make sure that you're letting elected officials know. Our next coalition meeting is scheduled for December 8th, 4 o'clock. We should have some more information about how enrollment is going at that time. Does anyone have any questions for me?
No, I think we're all impacted by the information and the negative impact that will have in our communities. Thank you for the advice of contacting the elected officials to let them know how severe this is going to be for many, many in our city. And please, let's advise the community to be active and start contacting the connectors. Thank you, Dr. Irwin. Thank you, Mission Maker. Appreciate it. For the Immunizations Advocacy Committee, I would like to share that Dr. Carico has decided not to continue as the co-chair for this committee, and Dr. Wang Schrader has accepted to continue leading this committee. She's an infectologist at the moment, seeing patients, but she doesn't have any comments. The only thing she wants to know, she wants all of us to know, is that they will try to continue meeting and trying to find the best way to advocate for immunizations or organize the efforts that the Board of Health can help and contribute to it. For JCPS Health, I don't see Dr. Eva Stone present. We would go to Greater Louisville Medical Society. Now I yield the floor to Dr. Jeffrey Goldberg. Dr. Goldberg.
Yes, good morning. Two things to report. First, the Greater Louisville Medical Society is in the midst of wrapping up our fall Wear the White Coat program. For those of you not familiar with it, this is an opportunity for non-physicians who have an interest in healthcare policy, which I think is just about everybody because it certainly touches all of us. It's an opportunity to actually spend one or more days shadowing a practicing physician. And it's bookended by both a breakfast and a dinner at the end of the program, allowing everybody to share their experiences. For those of you who are interested in participating in the future, we do run this every fall. If you would like to participate, we try and accommodate everybody that we can. Our past participants have included elected officials, business leaders, community leaders, again, anyone who's interested in public health or public policy. So if you are interested, please get in touch with me via the chat or contact the County Medical Society at glms.org. And then we are currently accepting nominations for our Physician of the Year Award. This is presented at an annual Doctors Ball banquet every spring. This year it'll be in March. This is a fundraiser for scholarships for the U of L School of Medicine. But we honored one physician from each of the three major health systems in the Louisville area, and then additionally, one community physician at large. If you are interested in nominating anybody who you think should be Physician of the Year, we are looking for physicians who have served as role models in the medical community, who've given back to the community, volunteering in various ways. If you know of somebody who you think is deserving of this award, again, please feel free to contact me or the County Medical Society.
Thank you very much, Dr. Goldberg. Now we go to the Kentucky Nurses Association. I yield the floor to Ms. Eleanor Manson.
Good morning. I would like to report that we're days away from our gala, which is a fundraiser for the Kentucky Nurses Association. At the gala, we will provide awards for honorees for Nurse of the Year, Researcher of the Year, Citizen of the Year, Volunteer of the Year, as well as DEI Champion of the Year. We also will have our conference the next day. The gala is on November the 13th at the Olmsted. The conference is November the 14th at Spalding University. I guess our biggest news is what has happened with our food pantry within the last 4 days. We've had 10 nurses and nursing students to request assistance, and we are running low on funding. So if any of you are inclined to support nurses and nursing students with food insecurity, please donate through our website. We are anticipating a much larger request as time goes on. I think that's about all I have to share today.
Thank you very much, Ms. Manson. And with this, we finish our committees and subcommittees. Is there any old business? And if not, we are going to go to new business. There was an invitation from the Committee for Boards and Commissions for representative from Louisville Metro Board of Health to the ad hoc committee on efficiency of boards and commissions. This will happen on Tuesday, November 11th at 5 p.m. The committee wants to learn and understand more about the Board of Health and the work we do. I will go there representing. And in case I won't be able to come back due to the airport being closed, Dr. Eccles also will be attending. After the meeting, Ms. Arlana will distribute the Robert's Rule of Order and action needed on revised open meetings and open records materials and a certificate of receipt or distribution to be sent back to the Office of the Attorney General of the Commonwealth. So beware of this. It's some reading to do, but most of all, you have to fill up the certificate of receipt and send them back. And I mentioned the need to elect the chair and vice chair for the 25-26 Board of Health, Louisville Metro Board of Health, and I propose myself to continue or complete the second year until July 2026 as chair, and Dr. Eccles has also agreed to continue in her position as vice chair for to complete the year until July 2026. So now we have quorum. Let's proceed to vote to elect the chair and vice chair for the Louisville Metro Public Health and Wellness Board of Health. May I have a motion to proceed to elect Patricia Bautista Cervera to be the Louisville Metro Public Health and Wellness Board of Health chair for August, July 2025 to July 2026. May I have a motion?
So moved.
May I have a second?
Second.
All in favor, please raise your hand and say aye so we can be counted.
Aye.
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 Arlana?
Dr. Eccles, okay, I see you. Sorry. My writing was covering you up, so we're good. Thank you.
Thank you. And with this, we have a quorum, and Patricia Bautista Cervera has been elected to continue as chair for the Louisville Metro Board of Health and Wellness until July 2026, when we will have the next vote to elect the next chair. May I have a motion to proceed to elect Dr. Emerald Eccles to be Louisville Metro Public Health and Wellness Board of Health Vice Chair for the period of August 2025 to July 2026. May I have a motion by a board member?
So moved.
May I have a second? Thank you. All in favor, please raise your hand and say aye.
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 Aye. Any opposed? Very good. With this, we have a quorum votes, and Dr. Emerald Eccles has been elected to continue as vice chair for Louisville Metropolitan Health and Wellness Board of Health until July 2026, when we will have our next election. Let's adjourn. Thanks everyone for taking time to participate in this month's meeting. The next meeting will be held on Wednesday, December 3rd, 2025 at 8 a.m. And this will be a virtual meeting as well. If there is no further business, the meeting is officially adjourned. Thank you so much. Thank you, everyone.